Doctor, are you duly licensed in this state to practice medicine and surgery? Yes, I am, and I have been so licensed since '57. Are you board certified, doctor? I am. Do you have, doctor, an area of specialty? I do. And what is that? It is orthopedic surgery. What is, doctor, your medical specialty? Orthopedics, as I said. Do you have a subspecialty? I have a subspecialty. Which is what? As I said before, it is orthopedic surgery, I would term it. Defendant's counsel, Your Honor, the defendant will concede the doctor's qualifications in this area of specialty. The court, do you accept that concession, counsel? Plaintiff's counsel, yes, Your Honor. The court, so it is stipulated that the doctor is qualified as an orthopedist and you don't have to proceed to interrogate him on that subject in depth. Plaintiff's counsel, yes, Your Honor. The court, go ahead. In the course, doctor, of your professional practice, did you have an opportunity to see the plaintiff? Yes. When was the first time that you saw the plaintiff, if you recall? From my records, I saw him on January 8th, 2002. Do you have an independent memory? No. At that time, did you perform, doctor, an exam? Yes, I did. What part of the body did you examine? I examined the right patella knee. Did the plaintiff convey to you his history, doctor, of a work-related accident? Defendant's counsel, objection. The court overruled. You may answer, doctor. Yes. What did he say? He said that the present complaint started 4 days ago when he fell at work, sustaining an injury to the right knee, which became swollen and tender right away. You say, doctor, the present complaint. Did the plaintiff have any complaints at the time of your exam? Yes. What? He did complain of right knee pain. And you conducted an exam, correct, doctor? Defendant's counsel, I object to the leading, Your Honor. The court, objection overruled. I'll allow it on these non-essentials. Yes, I did. What were your findings? My findings were the right knee was swollen and tender, and the range of motion of the right kneecap was restricted in the terminal few degrees of flexion. Doctor, you mentioned the degrees of flexion? Yes, I did. Was there anything else, doctor, that you found? I found, among other things, that the x-ray exam was within normal limits. Did you continue to treat the plaintiff, doctor, after that? Yes. Defendant's counsel, counsel, do you think you could cut to the chase? Plaintiff's counsel, all right, Your Honor, but I would appreciate a little latitude. The court, go ahead. I saw him 2 weeks later. At that particular time, did you make a request for any diagnostic testing or evaluation? Yes. What? I ordered an MRI of the right knee joint because at that time the complaints were mainly confined to the medial joint line of the patella, which is a very specific sign for a torn medial meniscus. Defendant's counsel, move to strike it as not responsive, Your Honor. The court, objection sustained. Strike it out. Now, sir, let me ask you this. Doctor, did you continue to treat the plaintiff subsequent to the January 22nd exam? Yes. When? I saw him on February 19th, 2002. At that particular time, did you have the benefit of any diagnostic tests? Defendant's counsel, I object as to form, Your Honor. The court, objection overruled. Yes, I had an MRI of the right knee joint and patella, which was taken on February 12th, 2002, and it reveals that there was a tear of the medial meniscus. Did you discuss any treatment with the plaintiff during that period of time? Yes, I suggested to him to consider right knee arthroscopic evaluation and meniscectomy. What was the response of the plaintiff to that treatment, if you recall? He agreed. Defendant's counsel, objection, Your Honor. What did he say? The court, objection sustained. He requested that, since this was a compensation case, permission to have the operation. At any time, did the plaintiff have the operation? Yes. When? April 24th. By whom? Myself. Doctor, when you performed the surgery, what did you find? The findings were that it was a large medial plica which is fibrous tissue rubbing over the anterior medial aspect of the knee joint. Okay, also there was a big chondral defect. It was 1 by 1.5 inches in the medial femoral condyle at the weight-bearing area. Doctor, did you find any calcium deposits at that time, or potassium? Defense counsel, objection, leading. The court overruled. At any rate, it is noted in the bill of particulars. Yes, also there were tears involving the posterior corner of the medial meniscus. Doctor, after you performed the surgery, did you continue to treat the plaintiff? Yes, I did. I saw him on May 2nd when I removed the sutures. Defendant's counsel, I object to the answer and move to strike it out. The court, I will allow it. You say that you removed the stitches. Do you know if he was working on May 22nd? No, he was not. I do know that as a fact. When did he cease work, doctor? I don't recall. I do.